COVID-19, cases on the rise. More than 6,000 Michiganders dead and 70,000 infected in just 4 months. Tonight, we'll take you to the deadliest spot in West Michigan. And the governor joins us. We'll ask if the state botched the reopening plan and if we're headed toward another shutdown. This is News 8 in prime time from Wood TV. COVID-19, tracking the data. Here's Susan Shaw and Brian Sterling.
Tonight, an attempt to illuminate the issues behind the debates and the noise on social media. A closer focus on the known data, the facts as presented, and the very numbers our state leaders are examining each day to decide when schools can reopen and when our economy can get back to normal.
We want to look at the trends to see where we stand and where we are headed. First up, the number of new deaths reported daily. For a couple of weeks in April, we routinely saw more than 100 Michiganders die each day. Over the past few weeks, it's been a single-digit number almost every day. Today, the state reported 16 deaths, although 13 of those are from previous days that were found during a records check. The overall death toll now stands at 6,101. Here in West Michigan, Kent County has twice as many deaths as any other county, with 142. Kalamazoo has 71 after reporting 1 new death today. Muskegon has 54 and Ottawa County has 48 deaths.
We're also looking at the trends of new cases and how many tests the state is doing. For the past few weeks, we've been hovering right around 300 to 400 new cases a day, although those numbers are up this week. Today, 645 new cases were reported. Overall, more than 71,000 have tested positive, and some 54,000 people have now recovered. And then there's this graph. This is the number of tests coming back positive every day. In June, fewer than 2% of all tests were coming back positive. Now, about 3.5% are. Yes, we're doing more testing, but that percentage is what you want to pay attention to. The state's chief medical executive says the goal is to keep that positive rate below 3%. Grand Rapids is the focus of state officials right now. After enjoying the status of one of the safer areas in our state early on, the numbers here are going up. 3.7% of tests are coming back positive. And about the same is happening in the Detroit area right now. The rest of the state, however, doing much better, including in Kalamazoo. The Kent County Health Department tells us the test results in Grand Rapids are concerning.
We've also seen an increase in testing, but the positivity rate has increased as well. And that's concerning because typically when we would expand testing, we would expect the positivity rate to come down. And that hasn't happened. It's actually ticked up a little bit from about 3.5% up to around 4%. So, I am concerned that that transmission has been increasing lately, and we all need to buckle down in order to stop that from happening.
The goal of shutting down businesses and forcing people to wear masks is to keep hospital beds open for new patients. It's about not overwhelming our frontline workers. Over the past few days, the number of people hospitalized has risen in West Michigan. We pulled that new data today. Spectrum Hospital is at 65% occupancy. Metro Hospital is at 58%. The situation is worse in both Kalamazoo and Holland. Bronson Hospital is at 74% occupancy, and Holland Hospital is at 80% occupancy.
Behind the daily stats, a closer look shows the brunt of this pandemic has been felt inside the walls of our state's nursing homes.
Tonight, in a new Target 8 investigation, we are learning about conditions inside West Michigan's deadliest spot, SAMARITAS Lodge in Grand Rapids. That's where state records show 31 people have died.
Target 8 investigator Ken Kolker is learning that the home now ranks as one of the worst for COVID patients in the entire state, up there with the bigger nursing homes in hard-hit areas of Detroit.
It got so bad here at SAMARITAS Lodge that workers wore plastic bags because they didn't have enough personal protection gowns. Loved ones who've lost relatives wonder why so many have died. The state is asking the same question.
This is the greatest spectacle in racing.
The family of F. Ryder Overstreet expected him to live longer. maybe long enough to watch one more Indianapolis 500 race on TV. That's him in the checkered socks. He had gone to the race 68 straight years, a streak broken a few years back only because of his age.
We didn't understand why he got this so quickly and died.
The 86-year-old great-grandfather, an Alzheimer's patient who lived in a private room at Samaritas Lodge on 32nd Street, died on June 18th of COVID-19 pneumonia, 5 days after he and his wife had celebrated their 61st anniversary by video chat.
It upsets me. My daughter is very upset, and she was very close to my dad, so it's very hurtful that he had to go in this way, that maybe it could have been prevented.
Her dad is among 31 Samaritas Lodge residents who have died COVID-related deaths. So when you heard there were more than 30?
I was shocked. Not surprised, but shocked.
76 residents have tested positive, along with 24 workers at the home, some in the last few days. 8 of the deaths were reported since early June, the latest on July 4th.
If I knew that it was going to turn into what it did, I would try to find a way to get him out of there and bring him home for a while till this was over. I didn't know that it was that severe there.
Samaritas Lodge has had nearly as many COVID deaths as all other nursing homes in Kent County combined. It ranks 6th for deaths among the state's nursing homes. The top 5 are in the hard-hit Detroit area and have more beds.
That's very concerning because that's not a very big facility.
31 COVID deaths, 125 beds, a 1-to-4 ratio.
If you had to send a loved one to a nursing home, I mean, would you choose one that has had 31 COVID deaths?
No.
No.
No, I would not. I'd quit my job and stay home if I had to, but I would not do that.
The director of AARP of Michigan says the COVID death rate at nursing homes shows a need for immediate change.
This is not rocket science. We just need to figure this out. People are literally dying while we're trying to figure all this out, and that's not acceptable.
It's not clear why COVID hit Samaritas Lodge so hard. The home passed a federally required infection survey in April. But inspection reports show 50 violations over the last 3 years, including 4 for infection control and more than $38,000 in fines. The state says it sent a team of inspectors to the home last week to investigate. A report on its findings, though, was not available. The feds require states inspect nursing homes when COVID cases hit certain levels, including 10 or more deaths. So far, more than 80 homes have hit that mark, most near Detroit. Nearly a third of the 6,300 COVID deaths in Michigan have come from nursing homes.
They're very alarming, and it's one area that I don't think anyone in the nation has completely figured out yet in terms of a national strategy or best strategy for nursing homes.
The Michigan AARP director questions whether hard-hit nursing homes are doing enough to control infections.
We're hearing across the nation that nursing homes still sometimes don't have the proper PPE, protective equipment, for their staff and or their patients.
The state long-term care ombudsman who represents residents at Samaritas Lodge confirmed that the home for a time used trash bags as gowns for personal protection.
I mean, if that's all you have, that's all you have. And I guess I have to, appreciate the fact that they were trying to provide and do what they could with what they had available. But that wasn't the go-to. It was just more that there wasn't any to be found.
There are residents who are wondering why so many have died of COVID-19 at Samaritas.
Put your pinpoint on it, it would be we're hard pressed to say that this is the reason. Of course, I would say infection control, we always have to look at that. That's going to be a core thing to see. Could they have done it better? Was there a failure in that?
It could also be, she says, the high number of memory care patients at the lodge.
They can't process why they might have to wear a mask, why we need them to wash their hands again.
Could this just have been bad luck for Samaritas?
Probably.
In a statement, nursing home officials said they have followed all county, state, and federal COVID-19 guidelines. The home last month replaced an administrator and the director of nursing, though its statement said that the moves had nothing to do with quality of care. A source at the home says it recently started mandatory weekly COVID testing for residents and staff, The source says the home is half empty after it sent most COVID patients to state-sanctioned centers.
It's been something that
the daughter of COVID victim Ryder Overstreet still can't understand how he caught it. He was in a private room and couldn't get around on his own.
That's what people's opinions are. Well, he was in a nursing home, you know, he was old. It doesn't diminish his life that he was in a nursing home.
In Grand Rapids, I'm Target 8 investigator Ken Kolker.
The governor has created a nursing home COVID task force with a deadline of August 31st for recommended changes.
Within the past hour, SAMARITAS sent us a follow-up statement, adding some more information about the situation at that nursing home. Quoting from the release now, when several residents tested positive concurrently, we recognized the need to isolate and quarantine for safety and transported several residents to COVID-specific hubs as directed by the state of Michigan.
The statement goes on to explain overall 15 COVID-19 positive residents passed away while in our care at the lodge, and half of those were hospice residents. 5 residents passed away in the hospital, and an additional 13 residents expired after being admitted to the hub skilled nursing facilities. Because of state requirements, those deaths were all attributed to SAMARITAS.
Continuing on, it's quoted as saying, we're closely working with the health department and area health care providers to care for those affected and to mitigate any further spread within the community. Additionally, we want to assure residents, families, staff, and the community at large that we'll continue to do whatever we can to remain transparent and provide the best care possible for our residents under these very difficult circumstances. You can read this entire statement from SAMARITAS over at woodtv.com.
For answers about the state's handling of this pandemic, we want to welcome in Governor Gretchen Whitmer. We are going to talk schools, business closures, and masks.
Okay, first, Governor, after listening to your press conference yesterday, I got to admit, I came away feeling a little pessimistic. It feels like we're slipping a little. We're headed in the wrong direction here. What is your assessment of how Michigan's doing right now in the middle of July?
Well, listen, if you look across the country at what's happening, Michigan's in a stronger position than a lot of other states. But the fact of the matter remains, we are seeing our COVID-19 numbers increasing in every part of the state of Michigan. That's troubling because, of course, in less than 55 days, we're hoping that our kids can resume in-person instruction. And if the numbers are going up and they stay in the same trajectory, that's probably not going to happen. And that's why it's so important that we double down on what we know does work. There's ample evidence that shows masking up is a great way to prevent transmission of COVID-19. We can't drop our guard. We know that we have had some slippage here, and that's why we wanted to do our best to nip it in the bud and stay at least in phase 4 if we can. But if these numbers continue to climb, we're going to have to make some really tough decisions, and I'm doing everything I can to keep our economy open, to get our kids in school, and to keep people safe. But it's on all of us to mask up and do what we need to do to prevent the spread.
As you mentioned, Governor, every parent and student watching tonight wants us to focus on schools. We can't predict where cases will be in a month, but we want to try and get a better idea of the threshold that you'll be using in making those decisions. So if tomorrow was the first day of school, would you allow students in the classroom?
So currently we are in phase 4 in the Grand Rapids area, as well as 5 other regions of our state. There are 2 regions of our state that are in phase 5. That's a better place to be, and that's what we all aspire to. But the fact of the matter is, in all 8 regions, we see spread happening. We're thus far able to do a lot of testing. We're doing about 21,000 tests a day, which is a vast improvement. We see our positivity numbers going up, which is concerning. But at this juncture, we're still in phase 4. What the council did was advise me about how we can re-engage schools in a safe way. Each school district is required to have a plan for phase 3, which is distance learning, a plan for phase 4, which is where the greater Grand Rapids area is in. And so that is in-person instruction with some serious protocols and requirements that need to be followed. They also have a plan for phase 5 in the event that we drop our numbers and can re-engage more sectors of our economy. So it's all going to depend on what phase we are in terms of the re-engagement. That is determined by percentage of positivity. That is determined by hospitalizations. That is determined by a number of factors, including, can we trace, is there a nexus for an outbreak, or is it unknown community spread? Those are very different scenarios. And so we can't predict precisely where we're going to be. But what we can predict is that if more people mask up, if we wash our hands and don't congregate and don't go to a sandbar party or a house party, we can get to that point where our kids are in the classroom. But today's actions are going to determine whether or not that's possible.
Okay, we'll have to wait and see what happens in a few weeks. But what happens if students are in class and there's a positive case at a school? Would you recommend that that school close for a period of time? What's the plan if we do go back to in-person learning and a case comes up at that school? How do you handle it?
So the districts, we've got over 800 districts in the state, which means we have unique challenges and opportunities in 800 different places and ways. The districts will be coming up with finalizing their plans in short order. Parents are going to be able to scrutinize it and know exactly what the protocol and what's going to happen. If we have a big outbreak in a school, that's very different than if we have a student that has been cohorted, where we can trace everyone around whom they've been in contact and isolate that small group. So the circumstances really matter, and each district will have an articulated plan that they will follow in the event that that happens.
Governor, I know that we were under a lot of pressure back at the end of May and going into June about bars and restaurants reopening statewide. We did manage to do that, but again, cases spiked, and then bars had to shut back down. Looking back, do you think that we did that too quickly? Did we jump the gun there?
Well, you know what? People are questioning everything. Should we have moved faster? Should we have moved slower? Here's what we know. Each additional thing that we engage increases our odds of COVID-19 spreading. This virus doesn't move, people move. And as we're out and about moving, if we can wear a mask, we can drop the likelihood that COVID-19 will spread and infect other people. And that's why everyone masking up makes a big difference. In terms of bars, we have seen across the country, and certainly we saw at a place in East Lansing and some other places around the state, that is a place ripe for spread. People are projecting their voices to be heard over loud music, perhaps. They're inside. They're not wearing masks. That's the prime circumstance for spread of COVID-19, and that's why we've had to take a step backwards when it comes to bars. Right now, we still are permitting some inside dining when it comes to our restaurants. We're hopeful that people continue to observe these best practices and we don't see an outbreak, because I know this, no business wants to be ground zero where all of a sudden there's a major COVID outbreak. It was devastating. It's devastating for the patrons, it's devastating for the business owners, and that's why it's really on all of us to continue to do our part to keep this, push these numbers down.
But you may have to add more restrictions, true, because you're talking about sectors that would be at risk. Bars and restaurants are one thing, the auto manufacturers are another.
Mm-hmm. Well, you know, so far in auto manufacturing, we've seen, you know, a number of COVID cases, but no major outbreaks that have, you know, made us think that we should close down that sector. That's just not happened. But if we have too much of a concentration of COVID-19 all across the state, then the whole state might have to take a step backwards. And that's what I'm trying to avoid. I can tell you this, I know we are not unanimous in every decision that I've had to make. And each, I tell you, has weighed incredibly heavily on me. It's been hard. It's been hard for all of us. But I do think we're unanimous in the fact that none of us wants to go back to a stay-home order. I can tell you I don't. I want to get my daughter back in school in the fall. I want to make sure that our economy can continue to ramp up. And yet, the thing that I can't control is the individual behavior of everyone in our state. I can tell you this mask mandate is the law of our state. I'm asking everyone to please do their part so that we don't have to take those steps backward.
Governor, there are many residents in Michigan on that note talking about masks that are downright angry about wearing these masks. There was a deadly incident in Eaton County where someone confronted a man for not wearing a mask. What can be done to make people comply with this mask mandate?
Well, I think the biggest thing that we can do is to embrace this as a culture, take the politics out of it. I was grateful to see President Trump donning a mask. I acknowledge that Dick Cheney has been wearing a mask, so has Mike Pence, Mitt Romney. I think the more people that we can recognize in terms of people on both sides of the aisle showing the leadership that we need right now as a country, it's really important. We did a mask campaign kickoff yesterday with the coaches from Michigan State and University of Michigan to show we got to take the rivalry and the conversation of the politics out of this. The opponent, we're all on the same team, and the opponent is a virus. And the virus doesn't care what colors you usually wear. It just can move and infect all of us. And that's why if everyone does their part by wearing a mask, we'll get through this. We've just got to adopt the new mindset that no shirt, no shoes, no mask, no service. This is a part of how we've got to operate, and wearing a simple face covering can save your life, it can save others, and it can keep our economy moving forward and get our kids back in class. So it's a simple act that every one of us, just about every single one of us, is capable of doing. And if you don't want to wear a mask, stay home.
Some sheriffs are saying that they won't enforce this mask requirement. Do you have any ways to force law enforcement to comply with this?
Well, I know everyone kind of wants to go to those stories, and I guess what I'm going to focus on is that the vast majority of people want to get this right. We've shown that we are capable of doing this. We drove our numbers down. I mean, at one point, Michigan was leading the country when it comes to our containment of COVID-19. So I understand that there are people, perhaps they're on the ballot this year or they don't understand the law. But anyone who's taken an oath to uphold the law needs to recognize that masks are the law of our state right now, and it's incumbent on every one of us to do our part. Now, I don't want anyone to go out and start writing a bunch of tickets. It's not the goal. The goal is to increase compliance, not to penalize people. That being said, if there are people who are willfully violating the law, there will be repercussions, but that's not what we're most interested in. What we're most interested in is educating people what it's going to take to be safe, to get our kids back to class, to ensure that our economy keeps moving forward. And the simple thing that we can all do is wear a mask, just like we wear a seatbelt when we get in the car. Wear a mask when you go out into the public places.
Governor, we did want to ask about what's happening at nursing homes in the state. A third of all the deaths in Michigan have happened inside of long-term care facilities. In fact, 31 people died at a single facility in Grand Rapids. Now, you've taken some criticism for requiring nursing homes to accept COVID patients after they had been discharged from hospitals. Was that a mistake?
So first and foremost, we never required a single nursing home to take a COVID patient. That is a talking point that is totally incorrect. We followed the CDC guidelines early on when there was very little known about this virus. We followed what the CDC and CMS said that states should be doing. And frankly, every other state in the nation did the same thing we did. We said if a nursing home is going to return a resident who had been out with COVID, they needed to return them to an isolated place where staff was not intermingling, where they took certain precautions to protect the other residents from the spread. That's what our policy was. We never required that a nursing home take a COVID patient. So I think it's important that we really get the facts here. I know that this has become a political talking point. I think the real tragedy, of course, is that so many older Americans have died from COVID-19, and certainly in congregate care facilities, it's, that's going to make it even harder for an older population that's already vulnerable. But if this population also has a medical issue, I mean, that is the kind of person that is most vulnerable when it comes to this particular virus. We've learned this as a nation, as every state, across America has had a very similar experience with COVID-19. It's sad. We're continuing to work and to do best practices as we learn more about this virus as a country, and Michigan will continue to do everything we can to protect our residents in nursing homes.
And Governor, the GOP, they say that you're not being transparent on this. Is that the political football that you're referring to, or do you feel you've been transparent on that issue?
We have been transparent, but their talking points are that nursing homes had to take people, and that's just not the case. It never was. We've got ample, orders to point to, and in all of the hearings that the legislature has had, they haven't found one person, they've acknowledged it, not one who said they were required to take a patient. So I think it's important that the public has accurate information. That's how we protect ourselves. That's how we make decisions going forward. And the fact of the matter is, when it comes to nursing homes, this is a uniquely vulnerable population, and that's why we've taken such aggressive actions to keep them safe.
Governor Gretchen Whitmer, thank you so much for joining us tonight as we continue to learn how to navigate this through the state. We appreciate your time.
Thank you. Stay safe.
For colleges to open and stay open this fall, they'll have to be able to test students quickly for coronavirus. Tonight, we're getting a look inside of the lab where testing will happen at Western Michigan University.
News 8's Kyle Mitchell has our story.
Well, there's been some concern about the accuracy of rapid testing. Western says the one they use is 96% accurate. And if there's any question, they can do additional testing to verify results.
Even over the summer, COVID testing at Western Michigan University keeps moving through this drive-through line at the Syracuse Health Center.
We have done to this day around 1,000 tests since March 1st.
Director of Nursing Jessica Slate says the university is using a rapid test made by Quindel, which provides results in 15 minutes.
All of our testing here is done by appointment only, and our machines are able to do 50 to 60 tests per hour, and we currently have 4 machines.
Slate says WMU will continue to use this technology as it holds in-person classes this fall.
I feel very comfortable with our team here at Syracuse saying that we can, reopen campus safely and test people as needed.
While some rapid tests have a higher accuracy than others, many doctors say while they can be a good tool, testing for RNA from the virus is the most accurate way, but results take longer.
The RNA tests take hours to result, and not to mention that quantities are limited for supplies for those testing.
Slate says the university will be following CDC guidelines, which do not call for everyone to get a test.
The most important is testing people who have known exposures, who work in those frontline positions, or who are symptomatic.
Still, the health center says it has plenty of testing capacity and has had no issues getting supplies for the rapid test. As important as testing may be, it's not the only solution.
Testing just provides a snapshot in time, and that's not the end-all be-all. That it still is very important for people to take proper precautions and wear masks and socially distance when able and wash your hands and seek medical attention if you are having any symptoms.
In Kalamazoo, Kyle Mitchell, News 8.
We will continue to track coronavirus in our state and make sure that we're asking our leaders the tough questions about their response to the crisis.